Hello, this is Dr. Nurul Banna, and today we're going to talk about case 9 of Odell book. The case is called A Deep Caries Lesion, page 9, the 4th edition. Uh, First, the case summary is simply there is a 30 years old patient suffering from intermittent pain that comes and goes, and it was mainly in her upper right side, but she can't know which tooth is causing her the pain. So we began our investigation after taking the full history of the case and the full history of the patient itself. She looks fit and well. And by examining the maxillary right side, we find that the upper right second molar has a big deep cavity, which is mainly in the occlusal side. It looks okay. Apparently there is no bulb exposure. However, this intermittent pain that comes and goes every with cold and hot is causing severe pain to the patient. However, it doesn't last for long. We did a kind of pulp test in order to be sure from everything, and we find that the only tooth which is deeply carious is the second upper right molar, while the other or the rest of the teeth are all looks good without any kind of cavitation. From what we found, we can consider the patient as low risk caries risk patient, but there is a kind of immediate intervention we need to do. The immediate intervention will be a kind of palliative restoration. We need to be sure that this patient, when she goes to her home, isn't suffering from any more pain. And we need to ensure too that the bulb isn't going to be injured while we are making our restoration, because most probably this case is a kind of reversible pulpitis that can be treated just with a good restoration without a need of any kind of endodontic treatment. However, there is a very low incidence that we may need to do a first visit endodontic treatment, so we're going to apply rubber dam to be sure that everything is going to be okay. After applying the rubber dam, we try to make a kind of excavation, and this excavation is called it's a kind of incremental or stepwise excavation. This kind of excavation is mainly targeting on removing the infected dentin without removing the whole soft dentin. We can leave the affected one or the affected part, and we have to be able to recognize the difference between affected dentin and infected dentin, and we have to focus on the differences between different of the layers of caries dentin. Because the most superficial part, which is facing the enamel, must be removed as it is full of caries, full of acids. While we are going deeper and deeper, we will find a second deeper our middle part, which is a kind of bacterial or contaminated dentin. This dentin may be not removed, or it can be removed if it is so soft. And the final or the deepest layer is the affected dentin or demineralized, and is completely, we consider it as free from bacteria, so we never ever remove this part. After we applying our removal of caries, we are going to see how the bulb is will go to respond to our treatment. We have to avoid the deep excavation not only because of bulb exposure, but to avoid the wide dentinal tubules. As the wide dentinal tubules, as we go deeper and deeper, it will cause more pain to the patient and may enhance the bacterial entrance to the bulb. So after applying a kind of restoration, we may find these 3 layers of dentin, and these layers are going to be brown. Not all brown dentin are a kind of caries dentin. Some are reactionary, some are regular and some are irregular. As we go, we have to know that the valve is going to make a kind of response towards caries, either as a peritubular dentin. In case of peritubular dentin, it is formed around the inner wall of the tubules. The odontoblasts are doing it in a regular manner, and it forms a well-formed barrier. But in case of rapid reaction, we will find a kind of regular reactionary dentin or irregular reactionary dentin, and the worst is the irregular reactionary dentin. But in all the three types, we may find a kind of hard dentin, and once we find hard dentin, even if it was brown in color, we don't have to remove it. After the incremental removal or a stepwise excavation of the caries, we are depending mainly on the well seal of our restoration. So we are now focusing on how to make a very well sealed restoration, and this is usually achieved by a kind of adhesive restorative material as composites. However, we may need a kind of interim restoration. In case of interim restoration, we may focus on glass ionomers in order to help in more fluoridation to the tooth, and in order to allow for a second stage intervention, because the original way of doing a stepwise excavation was excavate and leave as much as possible of dentin. Don't try to touch the bulb. Apply your restoration and wait for 6 up to 9 months, and then remove again the restoration and make a final restoration. However, in our recent approach, we find that there is no need for a second intervention. We may wait until there is a real need to intervene as a kind of fracture of the tooth or the restoration, and at this case we try to excavate again and remove the previous restoration, and once we find a kind of hard dentin, we don't intervene or remove any further tooth structure, we just apply the final restoration. In this case, we chose the chosen restorative material was composite, and composite we tried to make it in incremental pattern in order to avoid any kind of shrinkage and leakage, because when we leave a kind of infected or affected dentin that may somehow contain a kind of some bacteria, we are depending on the well sealing of the restorative material that will not allow for an extra infection of the tooth. In this case, we are gambling on some main points, which are good follow-up, good oral hygiene measures for the patient, and the good sealing too. And we have to tell the patient before we dismiss her that if there is any kind of exacerbation for pulp pain, we may need a kind of endodontic treatment. However, we are doing this in order to keep our maximum conservative approach and keep her teeth alive to serve her as long as possible. Thank you, and see you in our next video, and bye bye.